So I see, according to my notes here, that you've been coming to my office for exactly 1 year. So today, the goal of this appointment will be to see how you are progressing with your chastity. And I'm just wondering how this new scenario that your mom and I have devised is working out for you. So last time you were here, I recommended to your mom that the way that you be milked in your chastity cage is that she tie you to the bed, and then she take her vibrator and she apply it to just the chastity cage. Also, I suggested that she put a condom over the chastity cage so that once you ejaculate into the condom, it can be removed for quick and easy disposal. I suggested this in order to create a situation for her of maximum cleanliness and ease. So I see that she's been milking you in this way now for a few months, adhering to the strict schedule. How is that working out for you? You don't have any complaints? That's good. That's good. I bet you're turning into a very good boy for your mother. Oh, I see here that we also added the ice packs to the testicles to reduce any remaining pleasure. The ice packs are working out just fine for you? No complaints? Really? You are a little gem, aren't you? Very good boy. Well, you know, we've been doing these monthly or so milkings really just for health reasons. They're necessary. But, you know, ultimately, our ultimate goal for you is going to be castration. And today during our appointment, I wanted to talk to you a little bit about castration and what that procedure is going to be like for you. These infrequent ejaculations were necessary for health reasons, but today we are going to discuss your castration. There are a few ways in which the procedure can be done. Sometimes we do this by injection, which is really simple. It's really easily taken care of with minimal pain, but it's not as effective as we would like. The procedures we've done in the past have involved injecting sodium chloride into the testicle, and the testicle effectively dies. We've stopped doing this in recent years just because it's not the most effective way to do it. So in your case, I'm going to recommend that we go ahead and perform a surgery. The surgery is not going to be done with total anesthesia. We're not going to put you to sleep. The surgery will be done with a local anesthetic. So you're going to be awake for the whole thing. I want you to know that we have a very capable nurse who will perform this procedure. So I'm going to go over with you a little bit more what's going to happen during the procedure. So you're going to be tied down to a bed, and we are going to administer the local anesthetic to the area that we are going to be performing the surgery on. You're going to be awake for the whole thing. You're going to be awake and alert for the whole thing, but we are going to do some things to reduce the amount of pain that you feel. There are a few different ways castration can be performed, and we've already gone through that we are not going to be doing an injection of sodium chloride because these things are just, they don't always take. And we want to be sure 100% that your castration is complete and that we're really doing a thorough job with you. Some other methods of castration that can be used are the crushing of the spermatic cord. We're also not going to be doing that. That is a procedure, it's very painful. It's something that we do if we have kind of a lot of males to castrate all at once, but on your day, it's going to be just you. So we don't really have to worry about needing to get things done quickly. We can really take our time with your procedure. In the past, we've also tried banding. The issue with banding is that we need to keep you immobilized for a very long period of time until the testicle dies. So again, it's something that is just too time-consuming and too ineffective. The surgery really is the best option, and it's what your mom wants you to have. So on the day of the surgery, we're all going to be there. The nurse is going to be there. I'm going to be there. Your mom's going to be there in observance. And also all of our female friends that feel as though this is something that they want to witness, they're all going to be there in the operating theater as well. So we can all watch the procedure while it's being performed. The nurse is going to create a small incision, and she's going to surgically remove each of your testicles, just so that we know that they are thoroughly, totally gone, and this is not something that's going to have to be redone. You're actually very lucky, because some of the procedures that we've used in the past, not only were they time-consuming, but they weren't as effective as the surgery, and they would need to be done repeatedly. So you're actually very lucky in that this is going to be a one-and-done kind of deal for you, or well, more like a two-and-done kind of deal for you, where you're not really going to have to come back into the office multiple times on multiple days in order to have the castration performed over a long period of time. It's going to be just one day, just one big event, and then after that you're going to be a unit. One thing that I think that you'll find really exciting about your castration day is that you're going to get out of chastity. And after your castration, you're not going to need chastity any longer. You know, chastity is really a temporary fix, but the castration is going to be complete, and it's going to be permanent. So you will no longer require chastity, because you will no longer be male. You'll be a eunuch. So on your castration day, the chastity device is going to be removed for the last time, and all of us are going to gather around and we'll have a real good look at it. I'm sure that over the past year, we'll all observe how much it's shrunk. You know, if you don't use it, you lose it. And you're really going to lose it. So then the nurse is going to go ahead and castrate you. Before each testicle is removed, I want you, this is part of your training, I want you to look at your mom and to beg her to have each testicle removed. And when the nurse takes that testicle away from you, I want you to thank her, because we're really doing you a favor here, right? And the proper thing to do would be to ask your mother to remove each testicle for you. And when the nurse takes it away from you, you should thank her. That would be the right thing to do. Because ultimately, this is for your own good. Ultimately, your mother knows what is best for you. And if your mother thinks that you are better off without your testicles, then that's true. You are better off without your testicles. And I think that too. I'm a medical professional. And as your therapist, I think that they should be removed. And the nurse is also a medical professional, and she's performing her job in removing them. So you should really thank all of us for the service that we're really doing for you here in taking away your testicles from you. So after you've thanked your mother and thanked the nurse for helping you and for taking away your testicles from you, we are going to preserve them in a jar with formaldehyde, so that they can be in your household and your mother can keep them. And that will be a reminder to you and her of this very special thing that she's done for you. I want you to really beg her. I want you to beg her to have the nurse cut it off for you. And then when the nurse is done removing your last testicle, I think that it would really be proper if you personally thanked the nurse, your mother, myself, and everyone else in the room who is there really to support you in your transformation. So we'll go over this a little bit more after your surgery, But after your castration is complete, you're going to have a whole new life ahead of you. You need to start thinking about what your life is going to be like after the procedure has been performed. What will your life be like when you no longer are burdened by these testicles that we women have been so thoughtful to remove for you? You're not going to be bothered anymore by these sexual urges that you really can't do anything about because you've been in chastity for all this time anyway. But nobody really wants you to do anything about your sexual urges to begin with. No woman would want you. So ultimately, this is going to be something that is better for you because you're not going to have these sexual urges that you can't satisfy. Also, I've heard from a lot of males that have been castrated, especially at such a young age, that they don't have that kind of, they don't have a lot of anger issues anymore. It just makes them calmer. The lack of testosterone has a really great calming effect on the body and the mind. So that's another thing that we're going to be very generously doing for you when we remove your testicles. Some other things that I've noted is that a lot of males that are castrated, they have a lot more mental clarity. Instead of being constantly distracted by their own overwhelming sexual drive, they can focus on things. They can focus on tasks. They can focus on really satisfying females and the needs of the female instead of always being driven by their own selfish kind of sexual drive, unnecessary sexual drive. So I've learned over the years that something that castration does for males, it just makes it calmer. It just makes it more eager to please females. It really takes a male that didn't otherwise have a place in the world or a proper way to relate to females, and it really gives him a place and a sense of purpose. Also, some things that we can do, we have to decide if you were going to live as sort of a genderless eunuch, or post-surgery we also could fully feminize you. Now, you're never going to be a real girl. You're never going to have a cunt the way I have a cunt or the way your mother has a cunt. But you can be less male, and you will be less male. We can do some things to make you more female. We can start feminizing your look. We can start putting you in some clothing that is more feminine clothing. We can start maybe putting you in some more feminine undergarments, which I'm sure will fit your body much, much better once those unnecessary testicles have been removed. So we can think about some things like that. We can think about renaming you. Maybe you could take a more feminine name now that you're no longer as male as you were. Ultimately, this is going to be a higher path for you. Ultimately, being female is superior to being male. And ultimately, a more female life will give you a higher path. So really, this is being done to you, and it will be physically painful. It will be emotionally challenging to let go of parts of your body that you've had your entire life. But once we take steps in this transformation, once you let go, you are going to learn that there is a much, much higher path for you, and the women will show you the way.